Hello, everyone, and thank you so much for joining our Advances in Autism Research and Care webinar series. We're so excited to start 2019 off with this great presentation. I'm going to welcome, first, actually, I'm going to do some housekeeping things. You should have a taskbar on the right side of your screen, and there's a little questions tab. If at any point a question about the topic or about the presentation comes up, feel free to type that in. And then at the very end, I'll be able to ask those questions to our presenter, Dr. Rachel Lofton, and she'll be able to provide some answers for those. There's also a chat function at the bottom. If you have a question for me or a technical question, you can feel free to type that in there, and I'll try to help you with that to the best of my abilities. Also, these are recorded, so you should get a link to the recording after the presentation, and it'll also be put up on our network YouTube page. Okay, I'm so excited to welcome Dr. Rachel Lofton to do our Adolescents, Internet Safety, and Autism presentation. Rachel is a clinical and school psychologist who specializes in autism spectrum disorder. She has extensive experience in diagnosis, assessment, and intervention to help promote positive outcomes for people with ASD. In addition to her clinical work, Dr. Lofton has been involved in cases involving special education, family, criminal, and civil law. She has particular expertise working with people with autism, intellectual disability, and other conditions that can increase social vulnerability and complicate interactions with law enforcement. Dr. Lofton's clinical research interests include interventions to increase independent function in young adults, strategies for increasing self-monitoring, transition to adulthood, and sexuality education and sexual identity in people with ASD. Dr. Lofton is an adjunct faculty in the Psychiatry and Behavioral Sciences Department at Northwestern University's Feinberg School of Medicine and is in the Psychiatry Department of the Yale School of Medicine. All right, without further ado, Rachel, you can take it away.
Thank you for that introduction. When I was first asked to speak to this group, I was given a little bit of leeway with my topic, and I decided to talk about internet safety for a couple of reasons. One is because in my clinical practice, parents are constantly asking about internet safety. It is a real issue and a real concern. Another reason is because I'm currently working on a transition project called Echo Autism Adult Transition. And as part of that project, we're training physicians to be able to treat young adults with ASD. And those doctors often have questions about internet safety as well. And then finally, the third reason that kind of drove me to this, in my forensic work, I find that often when people with autism end up getting into trouble, they're on the internet or they're on the computer, they're doing something related to the computer when they get in trouble. Not always the case, of course, but quite often it is. So I'm going to go ahead and change to my next slide here. What I plan to do is talk a little bit about an overview of use of the internet, talk a lot about benefits and concerns, and then give some practical recommendations. So the next slide there shows the very, very worried looking older people. And I think for many of us, there's a tendency to be afraid of internet access and technology because we're aware of a lot of the inherent risks. However, there are lots and lots of benefits. So I'm going to touch on those just to remind ourselves, what some of those benefits are. First and foremost is just the accessibility of information. And for people with ASD in particular, who can quite often be just sponges for information and love facts and get real pleasure from acquiring information, this can be a very great thing. The internet can satisfy the quest for information at a level of detail that really just wasn't possible before. Access to technology is, of course, crucial for career preparation. There are very few jobs in the world that one can have anymore without being literate in use of technology. And then finally, social avenues have really opened up for many people in ways that were never possible before. People can find subgroups and very small communities of other like-minded people in ways that haven't been possible. And then specifically, on the next slide, I'm going to talk specifically about some benefits in ASD and cite a couple studies here. The first 3 bullet points are referring to a study by Hedges and colleagues And they looked specifically at secondary students with ASD and how they use technology in supportive ways. And they found some really good things. They found that technology was helping to create independence, increased independence. It could be helpful in reducing anxiety, and that the respondents did say that they found more social opportunities because of their use of technology. In another study, the Byers and Nichols study, what they did is they looked at the prevalence and the frequency with which cognitively capable adults were engaging in online sexual activity of any kind. And what they found is that a lot of individuals were actually using the internet to answer questions that they had about sexuality. So they were using it for a very specific kind of information gathering that they might not have been able to do otherwise. And then finally, the last positive point that I note here, there's one study that found adults who were using social media reported that they were happier than those who didn't. Now, there could be a lot of confounding factors here, right? A lot might be going on, but it is interesting to look at the possible correlation between social media use and happiness. So again, having those social connections and meeting people may actually make people happier. I certainly in my own practice have seen people on the spectrum find their tribe online in a way that they haven't been able to do in a real world setting. And they're able to do that on the internet without all of the demands that come up when people are face to face. So the nonverbal communication demands are just completely erased, and they're able to respond at a rate that suits them, and they're able to kind of have some social engagement in ways that weren't possible when it had to be face to face. The next slide was a lot easier, I think, for most of us to think about, and it's what are all the things we're actually worried about? And the main thing I think that we worry about are really the social risks of being online. So any of us who work with middle school students or high school students have stories about online bullying. And I can remember very clearly when high school students first started using Facebook, and the stories started to emerge pretty quickly about the bullying that was taking place. For example, many students have been videotaped, and then videotapes are put on Facebook showing them doing something embarrassing or looking odd. I've had a number of students for whom fake profiles were created. Lots of different forms of cyberbullying, and those are just a couple of Facebook examples, but it's pretty widespread. The next bullet point is pornography, and there are some pretty significant risks with pornography, especially for kids who encounter pornography at a young age. It's hard to find solid data on this, but most numbers I've come across suggest that kids are on average 10 or 11 the first time that they see pornography online, and they typically find it accidentally. But I think what the biggest risk is, the biggest thing I'm concerned about when it comes to pornography is the fact that it's often a stand-in for sex education for people. And when it's a stand-in for sex education, unfortunately, kids are getting a lot of misinformation about what real relationships are like, and also some very poor modeling for social behavior. So when pornography is used as a model and it's used as a substitute for sex ed, it's extremely problematic. The next point is meeting people in real life. Often when people chat online, after some time passes, they decide they want to meet in person. And this can be really dangerous for a socially naive person, or even someone who's not that socially naive. It can be very dangerous because of all the vetting that kind of needs to happen first, and the safety that needs to be in place first. And then, of course, it's quite common for people to not be who they say they are. I quite recently did an evaluation of a man who had some charges of his own, But while I was talking to him about his charges and his history, his legal history, he disclosed to me that he was 14 and was talking to someone online who he believed to be a 16-year-old girl, and he agreed to let the 16-year-old girl pick him up. Well, when the car showed up at his house, it was actually an older man driving, and the older man told him that he was going to drive the 14-year-old boy to meet up with this girl. And the boy didn't ask any questions, and he got in the car and was unfortunately assaulted as a result. So those are the kind of worries that most of us have when we think about, what happens when people meet up in real life. Like, what are the potential dangers of that? Something that's much, much more common is individuals with autism can just say things that can be rude or misconstrued or miss the tone of an online discussion and end up coming across badly. So they can come across rudely or bluntly or insulting someone without really intending to. And if they are in a social media app or someplace where others who know them in real life see it, it can have really intense consequences in their day-to-day life as well as in their internet life. The next point is about radicalization, and this is a newer one. I think I think a lot of us didn't have this on our radar 10 years ago, maybe even 5 years ago. But what we're beginning to hear about in the media is the radicalization of people who are at risk, so socially vulnerable people, or lone wolves as they're often called, who are at risk to be pulled into some form of extreme thought or another. So often when there's an act of terrorism or an act of extreme violence, at the root of it is a person who's referred to as a lone wolf who has been radicalized or who has come up with a very specific belief set that they use to justify their action. And in this day and age, quite often that person will have an internet presence and they will be part of some online groups, and these groups have usually shaped their thinking. We don't have great research on this yet at all. There's a lot that's needed, but it's a very, very interesting and important area to start to look into. The next point is recruitment. So even among groups that aren't going to encourage, acts of violence, there can be some really problematic discussions, and some themes that come up could have a big impact on the readers. So I'm thinking here about, racism, misogyny, anti-Semitism, etc. All of these places have many, many homes on the internet, places where people are actively talking about them, discussing them. Lots of false facts are flying, and people who are reading this information, if they're not carefully evaluating the source and able to think about it in a critical way, are really at risk of getting recruited into that line of thinking, and that's very problematic. And the last point I have there is one that I don't worry about nearly as much, but it comes up a lot when you look at what are the internet risks for adolescents more broadly, not just people with ASD, and that's being advertised to. So the one way I do see advertising really affect this population, I've had many guys be pretty naive and not recognize what's an advertisement and what isn't. So when there are advertisements saying, people in your area want to chat with you, if you're a naive person, you might really believe that that's true and click on that and end up someplace you don't want to be. The next slide here, I want to talk a little bit about the psychiatric impact of the internet. And now I'm going to start conflating a little bit, because I'm going to talk about internet use, and I'm also going to talk about gaming. I realize that the gaming is a separate thing, and I shouldn't conflate the two. However, so much of the video gaming that occurs now is in an online and multiplayer environment. So there's a social layer to it, but it is on the internet. So it's kind of difficult to talk about internet risks without also kind of lumping it in. So excuse me for being imprecise, but that's how I'm going to do it. I think one really important and interesting finding is that with internet use, studies have found both increase in ADHD symptoms and in conduct disorder symptoms on the same day of increased use. And so when they look more carefully at that, they found that there's also poorer self-regulation and more just general conduct symptoms. So even outside of like the specific conduct disorder symptoms. And this is among a general population. This isn't just for people with autism. There's studies that find that bedtime use is particularly problematic because young people will get up in the night, text during the night, and will actually be much more fatigued in the morning, which in turn affects performance at school and other activities. There are a few different studies that suggest that cortisol levels and inflammation rates might actually spike after internet use. And some of the studies I saw found that this effect was even higher in adolescents than in adults. And then the last one here is autism specific. And this is a study that found that electronics in room, and particularly video game consoles that were in the child's bedroom, was correlated with oppositional behavior. And I think any of us who work with families on a regular basis know that this is an issue. I have a colleague who did her dissertation looking at inpatient admissions, inpatient psychiatric admissions, and what the triggers for those were. And she found that a lot of them were originally triggered by some kind of video game fight, right? Some kind of disagreement. Usually the parent was trying to get the child to stop being on the internet. Okay. On the next slide, I start to talk a bit here about addiction. So we see that internet use has psychiatric impacts, right? But is addiction one of those? And so I found a meta-analysis that tried to look at all of the studies on internet addiction, and they found that the studies cite a range from 1% to 26.8% of people being addicted to the internet. So very high rate. In one clinical Japanese sample, they found that for both ASD and ADHD, that the addiction rates were really high. And then also there have been correlations have been found between gaming addiction and poor impulse control and ADHD symptoms, as well as then the other psychological symptoms that you might expect to follow. So more depression, more anxiety, social isolation. And then I think interestingly, then going on to have more pathological pornography use, which isn't surprising, I guess, among people with poor impulse control. And then I think the next one was really quite a surprise to me, but there was a study that found that internet addiction was associated with suicidality. So even when they adjusted for depression, people who had a pathological use of the internet did have a higher rate of suicidality. So the risk for addiction, whether that's actually higher in ASD or not, I've seen some studies in both directions, but whenever the studies are from within the autism community, people who do autism research and they're looking in those populations, they pretty consistently found higher rates of addiction or higher rates of use. On the next slide, I do cite this very large study. So the Montez 2016, this is from the National Survey of Children's Health. So it's thousands and thousands and thousands of people. And that study found no evidence of difference between children with ASD and the general population in terms of their screen time habits. But overall, everybody was still using it at about 3 hours a day. So about 3 hours of screen time a day, which is pretty excessive when you think about sleep and meals and school and all the other things that need to fit into a day. Okay, I'm gonna go ahead to the next slide here. I want to shift into starting to talk about what do we do about this. And so I made two very, very lame visual supports to help kind of illustrate this. When we think about what needs to happen for internet safety, what do we need to have in place to make sure that we're mitigating some of these risks? There are really two things. One side, we need individuals to have a better capacity to regulate their own behavior, better impulse control, limits on their time, right? And having just better regulation in place. And then on the other side, we also need awareness of the risks and ability to kind of avoid them or manage the ones that aren't avoidable. To really do that risk assessment and decide what is reasonable risk and what isn't. And then the next slide, what does that translate into in terms of what we as adults need to do? I think on the regulation side, it really translates into scaffolding. So keeping people highly supported so that they can be successful and they can be regulated, and then gradually removing that scaffolding and helping them become more and more independent as they develop that capacity to regulate themselves. And then on the other side, on that risk mitigation side, education is really the key. Equipping people with the information they need for evaluating the risks and benefits, and then also education in terms of how do you go through the thought process? So what is the process for deciding if your behavior is safe or not? On the next slide, I give some of the American Academy of Pediatrics guidelines. I call this scaffolding just because I kind of see it fitting into that first oval. But they recommend no screens at all before 18 months, except for video chats and family chats. As kids get older, and again, this is a little broader, right? They're thinking more about television here. But what we find is that by adolescence, almost all of the screen time is viewing online content. So that's why I've kind of started off with this general guideline. And then the next step from 18 to 24 months, they say that high quality programming is okay, but it's certainly not necessary, that watching something like Sesame Street with your kids is fine. But they do suggest, even through the 2 to 5 year age range, that parents watch along with their kids and discuss what's happening and talk about it. And then even up to age 5, that you keep it below an hour a day. And then from 6 on, the AAP recommends consistent limits on the time and types of media. They recommend ensuring that use of screens doesn't interfere at all with sleep, and that it doesn't interfere with physical activity, and it doesn't interfere with other kinds of healthy behaviors and things that kids need to be doing, that they still have a balanced life. And I don't know about you guys, but for most of the kids I know professionally and just in my private life, they're in excess of these guidelines. I think it's very, very common to go beyond it and hard to stick to it. And then if we think in particular about parents of kids with autism who might have significant behaviors, parents might sometimes use these screens as a way of having a bit of a break. It might be even harder for those parents to enforce some of these limits and rules because they're putting energy into behavior management at other times. So this is the guideline, and it obviously makes a lot of sense, and it's a good best practice recommendation, but I think it's been hard for a lot of families to implement in real life. But I want to talk about what happens after that. So that's kind of the guideline till 6, but then what happens? On the next slide, I propose an example internet plan. So this is for an imaginary child. But what I think might be helpful for families is to go through this process of creating their own internet plan that suits their child and their child's needs. And I will, as I go through these, talk about how it might be tweaked for different families and different children. So here, starting at age 6 to 8 years, this child would have supervised use for schoolwork, because at this point they might have to look up words, or might have to do a couple things online. There are safe search options on the computer, so alternatives to Google. I'm sure you've all had the experience of doing a Google image search and then being surprised when you get something racy or something unexpected. And so it's good to have something like Kiddle, Kiddle, I think is how it's spelled, which is a Google alternative that shows only child-safe searches. Short increments of time are really important at this point. There's really no reason a kid who's 8 or younger needs to be on the computer for more than 15 or 20 minutes at a time. And the computer is kept in a central area of the home and not in the bedroom. That goes back to some of the research that we saw about having electronics in the bedroom. So it relates to sleep, but also just to having it in a public space. It's easier to have the supervision and the monitoring that needs to happen. From 8 to 10 years of age, primarily supervised use is what I'm recommending, and that there, again, continue to be safe search options. This is an age when a lot of kids, and perhaps even younger, a lot of kids will start to ask to play multiplayer games. They'll want to play Fortnite or something like that. And most of these games have settings where parents can set it so that only people who are already known to the child can be their friend, or can discuss with them, and that needs to be in place. So only friends in real life are okay to be in chat rooms or discussion groups or in these multiplayer games. There should be very clear and well-enforced time limits. In general, chats aren't appropriate. Some classrooms will have chats. There might be some other formats where they're needed for educational reasons, but in general, at this age, it makes sense to avoid them. And that the computer continues to be in a central area of the home. Now, as kids get older, like from 11 to 13, they start to need a little bit more independent use. So it might be appropriate for them to start chatting on specific topics on child-safe web pages. It might be appropriate for them to search for things on their own, or look at their computer a bit on their own. But I still continue to recommend that it's in a very central location, and that at this point, parents might consider getting tracking software. So tracking software doesn't prohibit the sites that a child can go to, but it logs them. And so that even if the history is cleared later, parents can take a look back and see where the child has been. At this age, for the typical kid, I would continue to recommend that they're only chatting and talking in games with people who they already know. And if any kind of social media is added, I think this is young for most social media, but if social media is added, that it likewise only be allowed to friend people that they know in real life and interact with people they know in real life. I think one of the scariest realizations for parents is that if their child does encounter someone online who tries to strike up a sexual relationship or does something else that's really kind of grossly inappropriate, it often shocks people that that can happen on regular apps. It can happen in Facebook. It can happen in Instagram. It can happen in these places that we don't associate with, kind of seedy sexual stuff. But unfortunately, I've worked on many child pornography cases where the person seeking the child pornography has met the children on Instagram, or has met them, on Facebook, has sought out people on these apps that, really should be pretty innocent social media apps, but they can still be used for pretty bad purposes. So it does make sense to really shut down these sites so that they really only have access to people they know personally who are their friends. 13 to 16, this is when you might want to question the safe search options. For some kids, they'll be mature enough and independent enough that you could take that away. They can start to see this information and process it and know what it is. So if they get a stray hit for something that is very sexual, they can make sense of it if they understand it. Tracking software is probably still a good age at this point, or still a good idea at this point. 13 to 16, you may also allow some gaming chats and some discussion, and you might let them expand their circle a bit. But it does make sense to review and check what happens there. A lot of times there, even if no one is trying any kind of sexual abuse or anything like that, sometimes it's just the language that's used in those environments can be really problematic. So a lot of misogynistic or homophobic language happens in these video game areas. A lot of racist language happens, and it would be very, very good to monitor that. So if your child is there, and perhaps you would even decide to let them continue playing that game, but it would certainly be something that would need to be discussed. And then the last age range I have here is the 16 to 18 age range. And this is the point at which you're really trying to get this hypothetical individual to launch, right? They're becoming more independent. You're removing safe search. You're phasing out the tracking software if they're consistently safe. You're not reviewing chats as much. You might spot check if a problem happens or if you're really concerned. But you phase out the time limits. And you may, at this point, start to allow the laptop in the room or allow the phone in the room at night or kind of loosen up the guidelines a bit. Now, these age ranges we talked about, as I said, it's completely hypothetical. There are 22-year-olds I know who have had a lot of difficulty being safe online and have agreed, in discussion with their parents, to allow some of the tracking software, to allow some of these other things that we think of as being more for children. But developmentally, this is the progression. The ages might change, but in general, this is the progression for the scaffolding that's really, I think, useful to think about over time. So in terms of the education, which is the next slide, what really needs to be covered with education? Several things. How to disclose information and when to disclose personal information, what is okay to talk about and what isn't. I have found it very difficult to teach children who aren't already skeptical how to be skeptical of people. I think a lot of kids tend to think that adults are paranoid and adults are really, looking out for evil people and just expecting to find evil people. But to some extent, it is necessary to pass on that skepticism, that people really aren't always who you think they are. And it might help, if you're working with or if you have a skeptical child with autism, it might help to pull up some statistics, and you'll find statistics that show how common lying is on the internet. How common it is for people to misrepresent themselves. So you might want to equip yourself with statistics if you're having trouble generating some skepticism. There are some rules to talk about. There's some rules to establish for in-person meetings. I think, it'd be easy just to say you can never meet anybody in person who you don't know. You can't go meet somebody you only met online. But there are a lot of potential missed social connections if you do that. And sometimes these online communities generate real friendships, and the people who do end up wanting to meet face to face and become real life friends as well. So I don't think they can be discouraged completely, but there definitely needs to be a lot of caution. So for anybody under 18 or 22, I think the first meeting really needs to be in a public place with a parent present. And from there, they can slowly start to get more and more personal and more typical of how you would meet up with friends. But Even adults who are trying to date online, the safety recommendation is that they first meet in a public place and somebody knows where they are. And certainly you need to up that and make it even more strenuous, your guidelines even more strenuous if you're working with people who are a more vulnerable social population. Use of language, I think, is a really important thing to educate people about as they're beginning to use the internet more and more. And what I mean by that is people on the internet, because they feel it's more anonymous, tend to use very extreme language. They tend to say things that people in real life don't say. And it can be a real problem if a person with autism picks up some language while playing a video game, or picks up some language in a chat room, and then decides to say some of those same things at school. So it's really important that they be taught, number one, these are probably not phrases or words you can use at all, right? If you can only say something when you're anonymous, it's probably not something that you need to say. But then also, if you do say it, what are other people going to think? How are other people going to feel? It might seem acceptable in the context of your game because everybody is yelling faggot, for example, or something horrible like that. But what does that mean for real people? What does that mean for actual kids when you say that? Privacy is a big thing that needs to be taught too. I generally teach my patients, I generally teach them that they should just assume that anything they do online is going to be seen by someone else. Because sometimes it will. Sometimes you will forget to clear your history and your little sister is going to be on right after you. Or sometimes your parents will know exactly what you've been doing. Sometimes, these things might get out, or somebody might copy and paste and show everybody else what you did. So just assume that that's going to happen, and it'll help you behave a little better. Legality is a tricky one. There are a lot of behaviors that were never clearly taught are illegal, but most of us figure it out. Most of us were never taught that pictures of naked children aren't legal. Sexual pictures of naked children aren't legal. But a lot of people with autism haven't been taught that. And they might just be curious and looking at all kinds of different naked pictures, whether it's, a really actual sexual thing or not. So it's important to point out to them what is legal and what's illegal. Hacking is illegal. There are a lot of behaviors like that they can get into serious trouble for. And so it's important to kind of go through and outline those with kids. And then the last one's probably the trickiest one, and that's the perception of relationships and behaviors. So this is in particular when I'm thinking about kids using social media. They need to be taught that everybody on social media is working to put their best foot forward and make everything sound sunny and beautiful. And just because everybody in their Facebook feed has a girlfriend or a boyfriend doesn't mean everybody in the world really has a girlfriend or a boyfriend. What life looks like online is not really what people's lives are like. Most teenagers, by the time they're 16, 17, kind of have that figured out. Maybe not fully. I think we're all kind of vulnerable to this. But in particular, I think folks with ASD benefit from a more explicit instruction on this, really helping them understand that what people present as their life online isn't really necessarily the case, and it doesn't necessarily mean that their own personal life or lack of the social life that they want, they're not really the only odd person out. There are other people in similar situations. The next slide is just this image of the shining the light. And what I mean to show here is that through education and through discussions, I think it's very important for parents and other caregivers just to put some light in some of these corners that people might be looking in. Educate them about the content. Make sure that they're avoiding isolation. They're not just kind of holding up on their own, but this is something that you just do publicly. When problems develop, when people are most vulnerable, it's when they are isolated and they're spending a lot of time on the internet on their own without talking to anyone, without any kind of competing points of view. And the next slide is my last slide with some general tips. And some of these, again, I'm like calling back to the AAP guidelines, but in general, it's very important for families to keep in mind some activities and some locations in the home where phones and computers just aren't used. So family meals are a great time. And at first I wrote dinner, and then I thought, no, it's not just dinner. Like, nobody needs a phone at breakfast. Nobody needs a phone at lunch. Family meals are a nice time to kind of have the break. Bedrooms. So I've mentioned this before, and it can be a really tough thing to implement, but keeping all electronic devices out of the bedroom, strongly recommended. As I said, there's a study where teens are really going and sneaking and being online long after they're supposed to be sleeping, and phones only make it easier. So to the extent that you can encourage families to keep the phones in some kind of central part of the house, I mean, that just makes a lot of sense. I put family game night, and what I meant for that is anytime that there is sort of a whole family activity or something going on, it's reasonable to have a family expectation that no one is on their phone. And that can be tough for parents, but nobody can be on their phone. And then the last is company. So when company is over, it's really good social modeling to have the phones put away, have the computers put away, and show this is how we interact. This is how we kind of take a break from our media. I often talk with families, if I evaluate a very young kid, I'll start to talk with families about beginning the limit setting early. So even before kids are gaming, are obsessed with being online, are using YouTube constantly, set the rules and set the limits so that by the time they are 12 and 13 and these things are becoming all-consuming, you already have those positive routines and habits established. They're used to giving up their phone before they go to their room, or giving up the iPad before they go to bed at night. It can be a challenge, but it's very important that parents model these things. I'm often out to dinner in a restaurant, and I'll see a parent, or maybe both parents, seated with their kids at dinner. And it's shocking to me when the parents are on their phones. Sometimes kids have their own devices, and they are too. But that's where kids are learning. They're learning by seeing the modeling from their parents. So having the break, letting everybody take a break from it, is really going to benefit the kids. It makes sense to keep track of age limits. It can be hard for parents to do with video games, but websites, you know, have a sense of what they're looking at and what the age limit should be. And then finally, even in the safe places, like I was talking about, like Instagram or Facebook, it's important that the safety rules are implemented and followed. I'm going to move ahead. If you move ahead to the resources page, which is the last slide, I just wanted to point out that I did include a few resources here. And the one thing in particular I want to highlight is the PC Magazine Guide for Parent Controls. You'll notice that I didn't go into any detail about parent controls or tracking software or anything. And that's because it's constantly changing and I just can't keep up, and I'm not tech savvy enough to kind of give that advice. But this is a very recent article about it. So I do point parents to articles like that can be really helpful. And then back up to the page for questions, I also included my email address and my Twitter handles. So I don't mind, you know, if there's something that you don't think of now, but you want to ask me later, I never mind taking additional follow-up questions.
Great. Okay. Thank you so much, Rachel. That was wonderful. We do have a few questions. And reminder, if you have any questions in the audience, you should be able to type those into the questions portal on the taskbar on your screen. So one question someone had was, do you have any suggestions for weaning kids or adolescents with autism off of using so much technology, particularly if video games or TV is one of their few specific interests?
Yeah, it can be so hard. I have a psychiatrist colleague friend who is Korean, and she always talks about in Korea they have a few very specific programs where you can send kids, and they can kind of detox from video games or detox from screens. And we have much fewer options like that here. I think it's going to expand, and we'll have more in the future, but definitely there's a need. What I find helpful for those kids who really don't have any other interests, a couple of things. It kind of depends on the level of functioning, but for kids who maybe don't have a lot of leisure skills, just don't know what a lot of options are to engage themselves, it can be really helpful to specifically train and teach different leisure skills and even give them a schedule. So a leisure schedule, so that, we tend to think more about scheduling educational periods or vocational periods, but some people on the spectrum really need that structure even for their leisure time.
Thank you. Yeah, that's really helpful. And then one other question. How do you have any recommendations about how to have conversations like this with kids or adolescents about internet safety and about the dangers of certain websites or the reason for tracking, that kind of thing?
Sure. Well, first, it's ideal to start from a very, very young age so that it's just always there and they're just used to it. But I know that's not always possible and not always the case. And I think it makes sense to talk about safety, not that you're afraid of anything that they're going to do, you're not worried about them, but it is safety from the perspective of worrying about what other people might possibly do. And it can be very hard because a lot of kids will be extremely defensive. They will assume that adults know much less than they do about the internet and about what the real risks are. But I think at some point, I encourage parents, you want to have a logical discussion to a point, and then there's a point where the discussion has to transition to, well, I'm paying the phone bill, I'm paying for the Wi-Fi, so this is the rule while I'm doing that. So I think a balance of those, like you don't obviously want to say, my house, my rules, and be really harsh about it, but I do think I've had a lot of kids respond really well to that because it's just so logical and reasonable. Like, yeah, but I'm paying for it, so here's what I'm going to do.
Thank you. Yeah, that sounds great. That makes a lot of sense too. One question, this might be on the resources page too, but do you have any recommendations for specific tracking software programs?
It should be in that, I think it's in that PC Mag article. This is the point where I'm terrible, and my own not being great with software is kind of going to fail me. I was seeing a kid for therapy whose dad is very, very savvy with computers and gave me a couple of ideas for specific tools to use. Like he did the research and he found some really cool tools. But unfortunately, they were out of date before before I was able to recommend them for too many other people. So I would suggest going to that PC Magazine article or then searching, that one's going to get out of date in another couple months probably too. So then searching from there.
Great. Yeah, and these slides and this whole presentation will be on our YouTube page. So if folks want to come back and look at this page, all these links will be on there as well. We have one other question, Rachel. Are you aware of any specific programs for people with ASD to educate and help with pornography use and the legal dangers for people with autism?
Thinking. Not specifically. So no, not specifically. I mean, it's a great need. It's something that someone should put together, but there's nothing I'm aware of. More generally, like this is not what you're asking at all, but more generally, I'm sure some of you have already seen it, but Google has a game about internet safety, and it's much more about, having good passwords and that kind of thing. But there are some general games like that out there that aren't autism specific, but they do teach broader internet safety, and those would probably be appealing to many kids on the spectrum. But specific to child pornography, no. And I found that I'm usually involved on the diagnosis assessment end of those kinds of cases, but sometimes somebody I'm already seeing in therapy has had some problematic behaviors, and we've had to look into it. And what I've usually done is just go through it myself and talk in really clear terms about what is a legal thing to look at and what is an illegal thing to look at when you're looking at pornography.
Thank you so much. One other question that came in. It says the transition to independence for higher functioning individuals into their 30s and 40s can be problematic with a lack of knowledge among adult providers and how to counsel these individuals. So often pediatric providers are frequently consulted. Do you have any resources you can recommend for perhaps older adults that are dealing with similar issues?
I guess I'm not clear on, so the issue is that older adults are just then becoming independent. So some of the issues that you might see in a 15, 16-year-old who's getting on internet access are suddenly emerging in an older person?
That's my understanding of it, but if the question asker wants to type something into me, I'll correct you. Oh yeah, they said yes, that's a correct characterization.
Thank you. Well, so the project I mentioned at the beginning that we're working on is called Echo Autism Adult Transition. And what we're doing there is, I have lots of great colleagues around the country, and on a regular basis, we're meeting with a group of adult and med peds physicians and trying to help them become more competent with autism and be able to better address some of these things that come up that might happen in their office. So hopefully a lot of great resources are going to come out of there. It's a new project, so we don't have a lot yet, but over time, hopefully a lot will come out. But no, what I found most useful is to take the materials that are meant for younger people and adapt them, or to take the things that are meant for people with intellectual or developmental disabilities and adapt them. So, the unfortunate thing is if you're a cognitively able adult with autism, you may still have some of the social needs of a person with a developmental disability, but some of the materials that were put together could be insulting or could really just not kind of get at the core issues that you might have. So I found that adapting can really be useful, but I haven't found anything that's specifically targeted for adults who are, kind of 25 and above.
Okay, yes, thank you so much. Yeah, and then this question asker also just noted parents are often coming back to pediatric providers for advice on internet and social media problems.
Yes, and I believe that's definitely the case.
All right, if there are no other questions, I think that concludes us for the day. I want to give a huge thank you to Rachel. That was wonderful, and I know a topic that a lot of people have been asking about. So I'm really excited to share all the resources you suggested and kind of spread this more broadly. And thank you so much to everyone who joined. That concludes our webinar for the day. You'll also be getting emails about webinars for February and March that are already scheduled. Thanks so much, everyone. Have a great rest of your Tuesday.
Thank you.
Thanks, Rachel. All right.